alaikum wa rahmatullahi wa barakatuh. Good morning, ladies and gentlemen. My name is Riham. I'm from Gaza Strip. I'm a master's degree student in Faculty of Health Science, Health Education field in UKM. Let me sincerely thank the Hashim Center for Palestinian Studies to giving me this opportunity to present in this conference. Inshallah, I will discuss the impact of Israeli war on the health situation in the Gaza Strip, the increasing of health emergency. I will briefing introductions and then the impact of ongoing war, the international community rules in addressing this crisis. First of all, let's started with highlight some of background data to frame the discussion. We must know that the total of 84 hospitals in Palestine, with just only 32 is located in Gaza. That's few number of hospitals. They are serving over than 2 million people residents in Gaza within area of just 365 square kilometers. And Gaza has only 13 hospital beds for every 10,000 individuals that are significantly lower than the global standard. Especially Gaza is giving as a high population density in the world. Among of 475 primary healthcare centers in Gaza, only 51 are accessible to serve the local population. And then we must mention about the restriction. We know that Gaza are suffering from closing order from 2006, and there is these restrictions are directly affected on the healthcare system. In the case of advanced medical treatments, the patient required to seek care outside Gaza. This process make taking a complex system of permits and checkpoints. The patient must apply for permits to travel to West Bank, to Jerusalem, or abroad. That's leading a backlog of application. This backlog of application, of many of which can be rejected under pretext security checks. Even when the permits are granted or approved, the patient and their family undergo inceptions, making the travel is physically and emotionally difficult. The delay of these procedures can lead to deterioration of patients' health or their death while they are on the waiting list for travel permission. Let's start with the first section of our presenting the health situation, the impact of ongoing war. We know that the ongoing war affected on increasing number of deaths and injury and missing people. That the number of martyrs exceed than 44,000, and missing people and the people under the rubble are exceeded 11,000, and the injured are more than 100,000 injured people. We must focusing on the targeting of healthcare facility and personnel. Around 500 healthcare workers reported killed, including more than 55 medical specialists. Those doctors are faced to attack on their families to force them to stop work, and around 28 ambulances were directly attacked, and there is 19 hospitals are currently completely out of the services. So this action not only disrupt health care but also instill fear among medical workers that's increasing this crisis. Since the beginning of the war, the order for forced evacuation of hospitals have not stopped, even at the expense of the lives of intensive care patients and premature infants. For example, there is Dr. Adnan Al-Burj. He is a very famous doctor or specialist, surgery specialist in Gaza. He was arrested by Israeli forces from the place of his working in Al-Auda hospitals, and the result of that, he died under a very difficult condition. Dr. Al-Burj not the only one killed in the prison of Israel, but there are too many healthcare workers are still unknown, and they has further impact the work force and medical services. And the other example of attack the physician, Dr. Iyad Al-Rantisi. The second topic, we must focus on the chronic disease management and restricted access to treatment. Gaza health care crisis has severely impacted patients with chronic illness like cancer and kidney disease, with limited resources, damaged facilities, and travel restriction that's making this condition nearly impossible. The dialysis patients who require regular treatment has experienced delay and insufficient treatment that's leading to death around from 30 to 50 persons. Around cancer patients who rely on specialized care unavailable in Gaza face immune challenges, and over than 100 cancer patients died due to lack access to life-saving treatment and the travel permit delay. And also the ongoing electricity crisis in Gaza severely limit the ability of healthcare facilities to operate effectively, including surgery, emergency care, and storage of medication and vaccines. The other topics we are focused on the humanitarian and environmental disaster, like the loss of water supplies by blockade of water, fuel, and electricity has exceeded this crisis by depriving Gaza of essential water resources and contaminated water and inadequate sanitation that increase diseases risks, adding to a humanitarian disaster. Over than 345,000 people in Gaza are classified at the highest level of food insecurity, that's mean in starvation cases. The factors that are contributed to this crisis include sharp price increases in essential goods, collapse of food system due to limited access to food markets, and infrastructure destruction, and reduced humanitarian aid entry to Gaza. Also, the most important things is still using of chemical weapons in this conflict. The application of white phosphorus has resulted severe burn, poisoning, and environmental harm that are affecting or directly affect on air and soil quality. The spreading of infectious disease by overcrowded shelter and insufficient sanitations contribute to rapid spread of infectious disease. That condition have led to prevalence of cholera, hepatitis, skin infections, and polioviruses. Additionally, the presence of body beneath rubble and accumulation of trash that are increase the risk of serious infections due to inadequate water, sanitations, and hygiene services. What we need from the international community. The international community must take urgent and decisive action to stop this genocide by implementing strict policies to prevent attack the healthcare infrastructures, which including medical staff, facilities, and ambulances. The increased pressure for an restricted flow of humanitarian aids is of utmost important step at this stage by establishing safe medical corridors, facilitating travel restriction by simplifying the process of obtaining permits for patients outside Gaza to prevent deterioration of health conditions in case of especially chronic diseases, urgent surgery, particularly for war victims. A call for medical delegation to come to Gaza Strip in response to the plea from the medical staff there, who are suffering from shortage of personnel in all specialists to save what can be saved of the patients. Restarting the power plants is of utmost importance to ensure the proper provision of health services and also contribute to operation of a clean water station. Investment is in rebuilding the healthcare system in a long term and enhancing research in Gaza is essential to address the multifaceted challenges facing its residents. By the researching must be focused on the health field, especially the use of heavy weapons which pose a danger to both health and environment. It is crucial for us all to advocate for immediate action to support and address the health crisis or the fast increasing of health crisis. Thank you all for your attention, and I'm very happy to answer your any questions. Thank you.